Hi, everyone. Welcome. We're going to be getting started in just a minute here while everybody joins. Good morning, everyone. Good afternoon, wherever you are in the world. We will be getting started in just a moment. Just to let you know, we do have the chat feature on if you want to, and the Q&A if you want to pop in questions throughout the presentations, and we'll get to them after each presentation. All right, well, we're a couple minutes in and we have a packed schedule, so I'm going to go ahead and get started. So thank you everyone for joining us today. My name is Sarah Hill. I'm with Enterprise Ireland, the trade and innovation agency of the Irish government, where we support Indigenous Irish companies to start, grow, and innovate. Today's webinar is a continuation of our Ireland Doing Business in Mexico webinar series, which is a collaborative initiative with the Embassy of Ireland in Mexico and the Irish Mexican Chamber, which Blaine Doyle will be sharing more about later on. And this initiative is these webinars. There's a purpose to provide practical advice on entering the Mexican market, sector highlights, challenges and opportunities of Ireland doing business in Mexico, and a chance to connect with fellow market and business leaders. We have amazing speakers for you to hear from today, along with a special address by the Irish Minister of State, Department of Enterprise, Trade and Employment, Robert Troy, as well as a welcome address by Ambassador von Hainitz. So as mentioned, we have a packed day for you. So without further ado, I'd like to welcome Ambassador Maeve von Hainitz.
Buenos días on Mexico, buenas tardes on Irlanda, good morning, and in Mexico, good afternoon in Ireland. As Sarah has mentioned, my name is Maeve von Hainitz and I'm the Irish ambassador here in Mexico City. I'm really delighted to be able to join all of you this morning, and I would like to start by thanking Enterprise Ireland, especially Sarah Hill, as well as the Irish Mexican Chamber, particularly its president, Blaine Doyle, who you'll hear from later, for putting together such a valuable event. I think right now in the embassy, we're in our final stage of preparations for next week's St. Patrick's Day events. We have a large number of events in both Guadalajara and Mexico City with a strong economic and trade promotion focus. And we're delighted that Minister Colin Brophy will be joining us for those. It's just really appropriate that we're starting off our St. Patrick's Day period in Mexico with this morning's Doing Business in Ireland Doing Business in Mexico MedTech event. I think it's important, however, to acknowledge at the start that while St. Patrick's Day is normally a joyful celebration for us, a time to reconnect with our diaspora and friends of Ireland throughout the world, and that this year we had hoped that it would be a moment of positivity, of looking forward after the pain and difficulties and challenges of the pandemic. Unfortunately, this is not the case, and we are deeply saddened by the shadow that has been cast on Europe by the Russian invasion of Ukraine. With the atrocities that we are seeing happening, not least the horrific bombing of a children's hospital yesterday, is really barbaric and very difficult to watch. On this St. Patrick's Day, we want to make it very clear that Ireland stands in complete solidarity with Ukraine and with the Ukrainian people. It can be difficult at times like this, in dark times like this, to focus on other things, to think about other matters when looking at the news coming out. But there is some small solace in knowing that in openness with other countries, in friendship with other countries, in cooperation and trust, we can build a more prosperous world and a better world for all of us. For Ireland, we always seek to take a collaborative approach, to be open to new ways of doing things and to bring people together around new ideas. And this approach has very definitely contributed to our success as a nation. As Irish companies grow and globalize, it's in large part due to the beneficial relationships that are created with welcoming and like-minded cultures and countries like Mexico. It's important to highlight these relationships and to take the time to better understand and learn from each other in mutual exchanges and events like the webinar we're having today, as well as in the type of communities that have been put together by the Irish Mexican Chamber. The government's commitment to Latin America was demonstrated just last month when we launched a new strategy for Latin America and the Caribbean, with Mexico, our largest trading partner in this region, at its very heart. This morning in Mexico, this afternoon's in Ireland's event brings a spotlight to the medical sector, which has significant growth potential in both Ireland and Mexico, with exciting opportunities for innovation and meaningful breakthroughs occurring at a really impressive pace. Ireland is one of the top 5 global MedTech hubs and home to up to 350 companies in the sector, including 14 of the world's top 15 MedTech companies. Over 200 of these MedTech companies are Irish, and one in five of those working in the sector are employed directly by Irish-owned MedTech companies. The impact of these companies on the economy is significant. In 2020 alone, Enterprise Ireland's life science clients achieved exports of 1.9 billion. The COVID-19 pandemic has, of course, accelerated the need for digital solutions across industries and digital transformation in one's manual and on-the-ground services. Many companies have realized the need for the best digital tools available to continue to excel in their respective fields. In this regard, it's promising to see the number of collaborations between traditional sectors and technology companies is rising. The acceleration of the digital adoption in the Mexican market is very significant, and many Irish companies recognize the increasing opportunities in this emerging market. It's really wonderful to see a rise in the energy across our nations to rebuild, connect, and support growth for mutual prosperity. And I have to say, in my time here, I've been really struck on both the travel I've undertaken and planned travel in Mexico about the level of interest in our economy and also specifically in the MedTech sector. I'm going in 3 weeks' time, for example, to Baja California, and there the medical sector proactively reached out to me to try, as they want to learn more about what Ireland has to offer in this area. But look, we have some great speakers this morning, so I'm going to leave it there. It's a real honor for me to be able to introduce our first speaker, Minister Robert Troy. Minister Troy is the Minister for Trade Promotion at the Department of Enterprise, Trade and Employment. He has, in the short time I've been here, this is the second major event he's doing with us, which shows really, I think, his personal commitment to looking at the Mexican market and seeing how we can develop it further. And I know that he's going to continue to work closely with us in doing this. Minister, thank you so much for joining us this morning, and the floor is yours.
Thank you very much, Ambassador, and good morning to our participants in Mexico and good afternoon to our participants here in Ireland. I'm delighted to be with you at MedTech in Mexico. I think the event comes at an important time in the Irish calendar, with St. Patrick's Day, our national holiday, our festivities just around the corner. And indeed, this year we celebrate the centenary year of the foundation of the Irish state. It's a time when we celebrate our heritage and renew our links with our global diaspora and business leaders. I know we are all looking forward to a future where both our nations can get our economies and societies back to full strength. The cultural, political, and social impact of Ireland's diaspora and expatriates are highlighted and warmly welcomed at every social and business event involving citizens of our two nations. It is through sharing of our learnings and our experiences in settings like this, and our continued partnerships and collaboration on common objectives between our two nations, that will enable us to overcome the current challenges and power global recovery. One of the strongest connections between Ireland and Mexico is through commerce. Irish and Mexican companies have a rich history of collaboration with the sharing of innovations and ideas that leads to mutually beneficial partnerships. In 2020, Irish companies doing business in Mexico exported over 80 million euros worth of goods and services. Many Irish companies sees Mexico as their entrance into Latin America and successfully work with local partners and distributors to increase jobs and prosperity in both our nations. At the heart of this is our Irish and Mexican businesses that export, invest, and innovate across our two nations. Over 100 Irish-owned companies across several industries are exporting into Mexico, with more each year working on entering the market because of the growing opportunities in manufacturing, MedTech, software, and services. This reflects the high growth opportunities and the mutually beneficial relationships between our two economies. Turning to the MedTech sector, Ireland's MedTech industry exports over 13 billion euros to over 100 countries every year, positioning Ireland as the second largest exporter of MedTech products in Europe. It is also the largest MedTech employer per capita in Europe, with 45,000 people employed in the sector. Ireland is ranked #1 globally for the most highly employable graduates, in which the MedTech sector benefits from this flow of skilled graduates produced by our universities. Close cooperation between industry and academic institutions ensures the evolving skill needs of the sector are continuously met. Ireland boasts 7 clinical research facilities, which support patient-focused research, and is ranked #1 globally for the exchange of technology and ideas. This supportive environment and generous government grant assistance is responsible for the impressive 75% of MedTech companies in Ireland engaging in research and development activities. In 2020, the OECD ranked Ireland as the 5th top global exporter of COVID-related products, and we played a vital role in keeping medical goods moving through the global supply chain. Before I close, I want to focus on one of the core messages for this St. Patrick's Day. While the experiences of the pandemic differed for many, it was in this time that we all discovered a deeper meaning of community. Community as activity directed towards the common good. We learned that a good society is a network of connected, resilient, and creative communities locally, nationally, and indeed globally. The events of the past number of weeks have shown us once again that community is a universal value that demands meaningful solidarity with our fellow human beings. Our focus is therefore on rebuilding connections and supporting communities across the globe, particularly the citizens of Ukraine. So as we look ahead to the new future, and as we get ready for a new world, to develop the industries of tomorrow and create highly paid jobs, we stand as a firm and loyal partner with Mexico. Can I thank Sara and the team in Enterprise Ireland for today's event, and indeed for your ongoing work that you do on the ground to support enterprise and Irish businesses. And to the participants that's on our webinar today, I hope you enjoy this event and I hope you find it very beneficial. Guramila Mahagav.
Thank you so much, Minister, and thank you, Ambassador. We really appreciate your thoughtful words today. So at this time, I'd like to introduce our next speaker, Jorge Santisteban. Thank you so much for being here with us today. And he is going to go through setting up in Mexico. So Jorge, the floor is yours.
Can you see me?
Yes.
Okay. Well, I don't have control on the slides, but I'm going to ask to pass them. Okay, yeah. Well, this is going to be interesting. I just have 10 minutes to speak about 40 years of experience. So let's do that. This is going to be just a presentation, very fast, regarding the process that typically international companies have to go through before establishing and having a hands-on operation in Mexico. Can you pass the next one? This is just promotion. This is who we are. We've been around for, I personally have 40 years of experience. The firm has 30, and we have only international clients that do business in Mexico. So based on that experience, can you change the slide, please? There's 3 ways of starting to do business when companies want to sell products or provide services in Mexico. The first one is the sales agent. The following one is the commission agency, where there's somebody promoting in the first place as a sales agent promotes the product, comes down here, is from abroad, and starts promoting the product. This person does not have to have powers of attorney or be able to bind the international company on the sales in Mexico. The following slide, if you may. Can you change it? Yeah, is a commission agent. Commission agent are normally people inside of Mexico, locally established. Could be companies, could be individuals. What they do is they get a commission for the promotion of the sales. So this is the second way that typically companies come down here and establish business in Mexico. They hire a sales promoting agent. The agent gets a commission and the product is sold, but it's sold abroad. It's not sold in Mexico. I don't want to get too technical, but I'm just trying to mention the highlights. The following one, can you change the slide, are distributors. Distributors are they're always Mexican companies. However, sometimes the international company establishes its own distributor company down here in Mexico. The distributor company imports the product or provides the local service and generates income in Mexico, pays taxes, and then any dividends are sent out if it's a subsidiary to the foreign company. Otherwise, the income stays in Mexico, and they use it for purposes of developing the activities of the distributor. The following slide, please. How do you secure your sale in Mexico? I mean, there are many options. These are the same worldwide. We also advise international companies in Latin America. So standby letters of credit, promissory notes, depending upon the type of product, registering inventory that is revolving inventory, that's registering for the foreign creditor, title reserve agreements, conditional sales, as you can see in the slides, bonds, guarantees by third parties. For example, the parent company provides a guarantee, an acknowledgement of debt when there's been delays in the payment and then the debtor agrees that owes money. An acknowledgement of debt is very similar to promissory note because they are taken over to the court and immediately can be executed. The following slide, please. If the parties are related, there are transfer pricing studies like in the rest of the world. That means that the company importing into Mexico, if it's related to a parent company that sells the product, it has to be at market prices. And for that, there's a tax issue if it's not under market prices, and an accounting firm has to provide a study in many occasions. The following one. When companies are going to be importing products, they have to be registered at the imported registry of general imported registry, which is before the tax authorities. This is to avoid contraband and informal trade. And they also have to be registered at the single file window of foreign trade, which means that it's an electronic platform where all the ministries involved in the particular product have to be supervising, like for example, the Ministry of Health in case of medicines that you will see, medical devices, etc. The following one, please. There are always other ways to doing business in Mexico. That is licensing and technical assistance, provision of know-how, management. Sometimes they want to set up a company to do that and they don't need it. They can do it from abroad. The following one. Um, Companies can either establish branches or establish subsidiaries. Branches could be just for promotional purposes and they don't sell any products. And branches could be also for income purposes. They can be established as a branch that will do business in Mexico, and they have to pay taxes. In both cases, they have to be registered, but in the first case of promotional branches, they just are registered for covering local taxes. Can you turn over? I already mentioned that branch for business purposes is really not practical because all the liabilities go all the way to the parent company, and we don't want that labor, criminal, tax, whatever. Can you change the slide, please? Establishing a Mexican company, and everybody can establish a Mexican company except for certain areas like manufacturing firearms or coining money, and there's no exchange controls. Dividends can be repatriated. Can you change the following? The typical companies recommended are stock corporations when there are several groups of interests trying to establish an operation in Mexico, so they divide the shares in groups, etc. Or a limited liability partnership, which is a closely held company. You always need either 2 shareholders or 2 partners. Nowadays, it's best to create ad hoc companies abroad to be the shareholders or the partners of the Mexican company. We won't go into details, but now they are requiring a lot of information on the shareholders or parents. So it's best to create an ad hoc company or 2 companies so they can be the shareholders or partners in Mexico. Can you change it? Main corporate taxes, 30% corporate tax rate. There's a tax on dividends at 10%, but according to the tax treaty with Ireland, it's 5% if the majority, at least 10% or more, is held by the Irish company. Next, please. Value-added tax. You all know about value-added tax. Is 16% the rate, and it's also charged on imports, not on exports, in case you want to export. Can you change it, please? There are products that are not subject to a value-added tax in their trade in Mexico, and one of them is patent medicines and medical devices as well, etc. Can you change it? Labor law in Mexico is no picnic. Obviously, coming from Europe, labor laws are more favoring of employees in Europe. Maybe same as here. We've done presentations for Swiss companies, and they say, well, that's nothing in comparison to what is in Europe. But in Mexico, everything is interpreted in favor of the employee, and the labor law applies immediately when there's subordination and once there's economic dependency. Can you change the slide? Severance payments are very high. You have to get a protection of a labor union that is friendly to you from the very beginning in case you have many employees or manufacturing operations. And there's a profit sharing that it has to be paid on the top of his 3-month salary and it's based on the profits of the last year. Can you change the slide, please? Labor outsourcing now is limited. It's blank labor outsourcing, putting employees at the disposal of a third party is not possible anymore. It used to be possible, but it is possible nowadays if the outsourcing services are very specialized. That is, they're not the same as the core business of the beneficiary of the labor outsourcing services. Can you change it? This is what I said before. Can you change the other? Once companies register for the labor outsourcing, all the agreements have to be registered, not only with the labor secretary or secretary of labor, also with the Social Security Agency and with the Employment Housing Fund as well. So it's kind of a hassle to have all these agreements registered every time because they have to indicate which number of employees, if they're male or female, etc. It's a lot of numbers. Can you change the slide? And for finishing, there's also immigration visas that have to be obtained. One is a business visitor that is obtained at the airport. is for 30 days, and it doesn't mean that the person is going to earn any income. It's just for visiting, for business purposes, but not generating income within Mexico. I mean, the purpose of visas and immigration is where is the source of income? And as long as the source of income is not in Mexico, anybody can come in and do business, sign documents, etc., and go out. If you want to stay here and just be more active and open bank accounts and generate money, then it's a temporary resident visa for 5 years, renewable. And obviously there's a permanent resident visa after the 5 years. An employer registration means that any company that has foreign employees has to be registered before the immigration authorities, and basically that's it. I mean, this is 40 years of work with different clients. I hope it was helpful. Thank you.
Thank you so much, Jorge. I know that was a whirlwind tour through some really useful information, really fantastic advice that you've summarized over the years. And so for everybody attending, we'll make sure that you get access to these slides because I think it's a great helpful guide. So thank you, Jorge. And
we have information for free if you want. We have developed a guide through the years that is like 50 pages, but is written for business people and touches on all of these aspects and answers basic questions that companies normally have in practice.
That's wonderful. That's really great.
I will share it with you.
Perfect. Thank you so much. And thank you for being here.
Thank you.
So at this time, I would like to welcome our next speaker, Malu Lara Mendez. The floor is yours.
Thank you, Sara. Well, good morning and good afternoon to everyone. It's a really great pleasure for me to be here, and thank you very much for the invitation to the Embassy, the Enterprise Ireland, and the Irish Mexican Chamber. So today we are going to talk about pharmaceuticals, fertilizers, and pesticides. So can we go? Thank you. So this is the main points that we are going to review. So next slide, please. Okay, first, to start talking about the regulation and the landscape in Mexico, we need to start talking about the COFEPRIS, that it's the authority in Mexico that authorizes this kind of products. So the Federal Commission for the Protection Against Sanitary Risk, well known as COFEPRIS, was created in 2001, and it's a decentralized organization for the Ministry of Health. The main objective of this commission is to protect the population against sanitary risk through three main activities. This is sanitary regulation, control, and promotion. And you can ask, what does it mean? Well, COFEPRIS define and set all the official standards, also define the activities of surveillance, and promote to comply these standards. So those are the first, the main objective of COFEPRIS. And as you can see in the flow chart, you can see the Sanitary Authorization Commission. In that commission, all the authorization, all the submission that you are going to do are going to be submitted in that commission. So it is important to know which is all the commission that constitute a COFEPRIS. So next slide, please. Okay, so taking that in consideration, now we can talk about the legal framework. And the main or the primary standard is the General Health Law, as you can see, for fertilizer, pesticides, and pharmaceuticals. So the General Health Law define in the Article 376 that this kind of products requires a marketing authorization, and the validity of it is 5 years. So we need to take that in consideration, because that is the process, and that it's the renewals, because every 5 years we need to renew these authorizations. As you can see, we have a specific standards for biotechnological products regarding the quality, the stability, and also all the clinical information that we need to submit. And in the case of fertilizers and pesticides, it's the same. So I'm leaving there the standards so you can have it as a reference. Next slide, please. Perfect. Okay. Now moving with the regulation that apply to the pharmaceutical, the first step that we need to define is the classification of the product. We can have small molecules, biologics, biotechnological products. As you can see in the general law, we can define and we can classify this kind of products. The definition of these products are set in our general law. And one important thing that we need to consider is who will be the marketing authorization holder. Because here in Mexico, we have a figure that the foreign company can be the marketing authorization holder, but it will need additional information and additional points to comply in the Mexican regulation. So next slide, please. In the case of fertilizers and pesticides, I would like to mention that not only COFEPRIS participate in the process of evaluation, other institutions of the government participate in the evaluation. These authorities are involved for example, for the agricultural ministry, they evaluate the biological effectiveness and the MRLs in the field. So that it's important because you don't know, you don't only need the authorization of COFEPRIS, you need to comply with other authorities. So that it's very important to keep in mind. And the environmental ministry also, they review the technical and they give a technical opinion about the environment. And finally, of course, COFEPRIS that evaluate the safety and the toxicology information. So those authorities are involved in the process of evaluation of fertilizers and pesticides. And in the following slides, we are going to review specific, which are the timelines and which are the needs for that point. Next slide, please. And which are the classification for fertilizers and pesticides? Well, those products are classified by its use or composition. So that is a very important point. We need, for example, when we receive the information, we need to review the label, the composition, the certificate of analysis. With that information, we can classify the product and we can move forward with the other steps. So as you can see by its use, the pesticides and fertilizers are classified. And this is regarding the Article 7 of the specific regulation of pesticides and fertilizers. So as you can see, we have the general health law that apply for those kind of products, but then we have a specific regulation for each one. Next slide, please. Okay, perfect. So as we can see in the previous slide, we need to set the classification. As soon as we classified the product, for example, biotechnological product that we are trying to evaluate, we need to define the regulatory pathway. And what does it mean? We have two kinds of pathway, the regular pathway and the expedite pathway. How is this expedite pathway known as a equivalence agreement? And this is COFEPRIS recognized some agencies to expedite the process of evaluation. As we know, COFEPRIS now it's taking more taking more relevant the reliance concept. So they are working very hard and they are issuing many documents of criteria of the application of this kind of new processes without taking in consideration their reliance. So we are going to review in the next slide, which are the countries that are recognized by COFEPRIS. And then, as I mentioned before, we need to define the marketing authorization holder, if it's a national or a foreign plus a legal representative. As I can tell you, my recommendation is to be a marketing authorization holder, your company, and to set and to have a legal representative in Mexico. And as Jorge was mentioning about the subsidiary, well, this is the option that you could have in the legal representation. You can choose a local partner, or you can set a subsidiary in Mexico to develop that kind of activities. But what is this, or what does this legal representative need? Well, those points are really important, because if you are thinking in setting legal representative here in Mexico, you need to have operation notice presented in COFEPRIS, a pharmacovigilance unit, a technical responsible, a QMS, and a power of attorney, including those activities of representation. So those points are really important when you are taking these kind of strategic pathways. And then you need to set a pre-submission meeting. The pre-submission meeting needs to be submitted for the legal representative or for the marketing authorization holder. So it's very important to define since the beginning. And then you can apply for the marketing authorization. When I'm referring for a pre-submission meeting for biotechnological products, I'm referring to the New Molecules Committee and a subcommittee. And this process is before the submission of the marketing authorization. Next slide, please. Okay, so these are the countries that are recognized for the equivalence agreement. However, we have very good news, because COFEPRIS launched a new list last week and define all the countries that are recognized by COFEPRIS, and Ireland, of course, is one of those. So that is important because, and also it's important to mention that it's a unilateral recognition. So COFEPRIS recognize the authorization, but the other agencies doesn't recognize COFEPRIS authorization. But for foreign products, it's you can have an expedite process with this new process that COFEPRIS has. Next slide, please. Okay, so which is the process, the regulatory process that you need to keep in mind? So if you are going to conduct clinical trials in Mexico, you need to consider 3 months for the protocol approval. And of course, the timelines that you will define for the clinical trial. But that is one step that you can consider, or you can bring all the clinical trials that you develop in your country, and COFEPRIS will recognize them. And other point that you need to present is the risk management plan, because for all the biotechnological products, we'll need the RMP. So pre-submission meetings are, as I mentioned before, the New Molecules Committee and the Subcommittee of Biotechnological Products. When you present in these committees, you need to have the RMP presented in COFEPRIS. So that is the first step also. Then you will have an answer from COFEPRIS 3 months later. That's the official timelines, right? Sometimes the timelines extend a little bit, but those are the official standard. Then you can go through the application that is paper-based, but COFEPRIS is transitioning to a digital submission. So we need to wait because they are opening more and more products to be submitted. And of course, if they require additional information, you will get a prevention. And finally, the resolution that could be an approval or a rejection. The official timeline is 180 days, but COFEPRIS is taking more time to issue that. So they are taking between 8-12 months to authorize a product. So that is very important, because if you are planning, you need to keep that in mind. And those are the COFEPRIS fees that you need to consider. The next slide, please. I'm gonna run a little bit because I think that I'm running out of time. So those are the main points that you need to consider for the submission of biotechnological product. Those are the technical requirements. As you can see, one of the most important things is the traceability and the stability of the information. Next slide, please. Okay, so these points are very important because it's pros and cons of choosing a local representative. So if you choose a local representative, you optimize resources, supply chain, you will have a guarantee in the supply chain because they know the process, realistic timelines, so they will give you a more realistic and points and timelines, of course. Avoid costly delays and foresee any issue. Of course, you will have, or you can face languages barriers because not of the local representative speaks English, so that is one point. And consultants expertise on the market and with the agency. So this is important because you will have a complete scope and a complete landscape of how the things are moving here in Mexico. And also, of course, continuous follow-up and current updates. Next slide, please. And cons, well, project budget legal terms, also those are points that that you need to consider. The focal point are not a team member, so sometimes the priority change between the company and the local representative. So those are some cons that you need to consider, and you need to talk and you need to set before the choosing a local representative. A lack of the company's vision, as I mentioned, and the regional vision and negative impact. Sometimes the local vision could could be a barrier for your growing your process and your business. Next slide, please. Well, this is 2 points that you need to consider: the supply chain and the expertise of your local partner, and which are the expertise in the distribution, in the importation, in the submission, and the post-approval activities. And of course, those activities need to be reviewed for the legal representative. Next slide, please. And for the fertilizers and pesticides, the process is quite similar. We need to define, as we reviewed before, the classification. But this point in the fertilizer and pesticides, it's quite different with pharmaceuticals, because for fertilizers and pesticides, you need to bring samples to Mexico to be evaluated for the agricultural ministry. So you need to get an import license. As I recommend is to get a local partner to import those samples, conduct the studies, but in parallel, you can start working in create and to create a subsidiary, because it's very important for fertilizers and pesticides. I do recommend to have a subsidiary in Mexico. So you can reduce 4 months to the timelines if you choose that road, to choose a local partner only for the studies, and then in parallel create a company. And then you need to select a third party that is approved by the agricultural ministry, and then you get the reports, the technical reports of those studies conducted. You need to present to the agricultural ministry. They accept it and give you a technical approval. And this technical approval needs to be submitted in COFEPRIS. So that is very important. Those steps are crucial for the success of your business of fertilizers and pesticides. And then you can apply for the marketing authorization with your subsidiary in Mexico. So you can consider 4 months working in parallel and then the submission in Mexico. Next slide, please. Well, which are the process as I was explaining? You have 5 months approx for the import license. You need to do the sample test and to have the study reports. And then you can go through the application in COFEPRIS because COFEPRIS receive the complete dossier and then split to the other authorities. This time, the official, as I mentioned, is 4 months, but the reality of this process is 3-4 years. But we have some experience working in some strategies to get the approval between 10 and 12 months. So that is very important because you need to be very clear and you need to set all the steps, as I mentioned, choose a local partner, so you reduce 4 months, and then move forward with the studies. So those points are guarantee that you get your approval in a short time. And well, COFEPRIS could approve or reject your application. And next slide. Thank you very much. I think that I run out of time, but thank you for the invitation.
Thank you so much, Malu. That was a really great way to shed light on this very complex process and really helpful to have that breakdown. Thank you so much. And so, yes, moving right along, I'd like to welcome Gloria Frias. Oh, you're on mute, Gloria.
I'm sorry. Thank you very much for inviting me to this webinar. I am going to talk about medical devices. We are a consulting firm that have more than 20 years of experience in this area. And we are focused on regulatory intelligence and all the submissions for foreign companies. Next slide, please. Okay, I am going to start to define what is considered a medical device in Mexico. In Mexico, medical devices are formed by medical equipment, prostheses, orthoses, and functional aids, diagnostic agents, including contrast media that in Europe are considered pharmaceuticals, in Mexico are medical devices. Also odontological supplies, surgical and healing supplies, and all medical materials, and hygienical products. Some cosmeceuticals are classified in these. So also a lot of consumer products with therapeutical indications can be classified as hygienical products with the medical device regulation. Medical devices require registration. This registration is also in COFEPRIS that Malu was mentioning and is valid for 5 years and can be renewed. Sometimes after the marketing authorization, the products require an importation permit in order to be imported to Mexico. Next slide, please. Well, what do you need to be a registration holder in Mexico? The registration holder is considered by COFEPRIS as the owner of the registration. So it needs to be a legally established company in Mexico with a legal representative with permanent residence in Mexico, with an operational warehouse with a quality system notified in COFEPRIS, also a sanitary or technical responsible that must be a pharmacist, biomedical engineer, or chemist, also notified in COFEPRIS, and a technovigilance unit. This is safety surveillance post-marketing. Next slide, please. What are the options? The first option is establish your own company in Mexico, and everything must be set up and notified in the Ministry of Health before the submission of the registration application. So you could be paying for a warehouse without using it until the marketing approval is ready. The other option is have another company to be the registration holder for you. Here are two options. One is your distributor, and the other is an independent holder company. Next slide, please. Here are some advantages and disadvantages to have the distributor holder registration. The first one is that they can have a conflict of interest with other clients. Most of them have no expertise in regulation. The advantages is that they will cover the cost of the registration, but the distributor will set the timing on the registration based on their priorities, and for sure they will have another representative companies too. They will decide if they want to include more distributors in the registration, which does not happen most of the time. Also, the distributor will have access to all the sensitive and confidential information about your product. The advantages of the independent holder is that there is no conflict of interest because their business are providing services, not selling products. So they have an expertise in regulation, but you will need to cover the cost of the registration. Also, you will have control over the registration based on your priorities, and you will decide how many distributors you will be including in the registration. It is important to mention that all the distributors that are included in the registration, they can import independently and market independently from the registration holder. The distributors will not have access to the dossier because they will also be provided with a copy of the marketing approval letter, and that's all they need to request the importation permit and to import. After approval of the registration, also there is some maintenance like the renewals every 5 years, and also you need to have approval of every new models or new accessories that you are launching to the market. Before marketing them, you have to include them in the registration. So when the distributor is the registration holder, you cannot transfer the registration to other holder without their will. There is nothing anyone, not even COFEPRIS, can do to understand the situation, to change the situation. If the distributor won't sign with a notary the transferal of the registration, it will be impossible to be transferred. So this is a very important thing that you might considering before choosing who is your registration holder. Yes, the IVDs are considered diagnostic agents and also are medical devices, and they are ruled by this regulation. Next slide, please. Also, there is grouping criteria in medical devices. It's similar to the Europe's grouping criteria, but Mexico has its own things. First, it must be the same manufacturer in order to get one marketing approval. They must be in the same class with the same intention of use, that is the final indication, and the same technology. New technology is considered a new registration. Also, all the materials for the same surgical procedure, even though they have different natures, can be included in one registration. In case of preformulated products, they have the same materials and active ingredients, and you can consider that all can be sold apart, must be registered apart. For example, if you have an infusion pump, the infusion pump is the equipment, is one registration, and all the consumables will be a different registration. If you don't have a different registration, every time you import consumables, you will need to import a infusion pump also, the medical equipment. So it is very important to consider that if your product needs some consumables, you need 2 registrations. Also, the final criteria is always the Ministry of Health. Next slide, please. How we classify the medical devices. The class 1A is low risk, and there is a very, very specific product list, and also only those products included in that list are classified in this class. For class 1 are mainly external products that are not sterile. Class 2, sterile or invasive products, temporary invasive for less than 30 days. And Class 3 are implants and invasive products that stays in the body for more than 30 days or have very high risk. For example, contrast media are Class 3. The classification and grouping is according to the Mexican criteria and ruling despite the classification in the country of origin. That is very important to consider. Next slide, please. Well, the registration requirements are mainly the same that you have in Europe and are ruled by the essential principles. We need a free sale certificate issued by the health authority of the country of origin. If you don't have this free sale certificate or the registration of the country of origin, then we will need to perform clinical trials in Mexico. The GMP certificate or ISO 13485 for every facility involved in the process. For example, the manufacturing, the sterilization, the packaging. Also, we need representation letters or power of attorney naming the holder and the distributors. And this is why you have the control over the registration, because only with this representation letter issued by the manufacturer, a distributor can be named on the registration. The technical dossier is pretty much what you have in Europe, but we must document every step from materials, manufactured and finished product, and demonstrating quality, safety, and efficacy. The statements and declarations are not valid. It's not enough to say that we have a validated process. We need to provide all this validation evidence. Also, it is very important for you to consider that sterile products need a sterilization test, microbiological test. It's not enough with saying that the product has been part of a sterilization process. The sterilization must be proved with the method of the European Pharmacopoeia. Also, we will need the original certificate of analysis or certificate of conformance for medical equipment, and everything must be submitted in English or Spanish and organized according to the COFEPRIS criteria. If there is another language, then we will need to be translated to Spanish. Next slide, please. The registration timing, as Malu mentioned, there is no compliance in COFEPRIS whatsoever for the timings. And based on our experience, we can say, for example, the new registration class 1A, the official time is 10 business days, but regularly they provide the registration between 1 and 3 months. Class 1 is 30 days, but the registration takes 6 to 10 months. For class 2, it's about 8 to 12 months, and class 3, 10 to 18 months. A right transferal is pretty fast, as well as a naming of a distributor once the product is approved, and it's between 1 and 3 months. The variations depend on the extent of the variation, but they usually take between 6 and 12 months, and the importation permit is between 1 and 2 months. Next slide, please. The applicable regulations are the General Health Law and regulations for health supplies, the Mexican Pharmacopoeia, and we have a supplement for warehouses, but also European Pharmacopoeia is valid in Mexico. If the applicable norms, we have a GMPs for medical devices. We had a labeling norm for medical devices. This is mandatory that all the products after the approval have a Spanish labeling pre-approved by according to this norm. And the consultant that helps you with the registration will help you to define what needs to be included in this label. And also after approval, we have a technovigilance norm that must be complied in order to be able to renew the registration. The biocompatibility testing regulations corresponds to the international standards, so you will have no problem proving biocompatibility. Next slide, please. Okay, the post-marketing obligations for the manufacturer is to maintain a safety surveillance system that it's inside a technovigilance norm, and notifying the Ministry of Health for any adverse reaction. And you need to generate a PSUR every 5 years. Also to maintain a quality system and allow tracking for every batch or serial number that you sell in Mexico to be able to recall the product if it is required eventually. All the products must be labeled as required by the labeling norm in Spanish. And you need to get a COFEPRIS permission prior to diffusion of advertising. It can be public, for the public in general, or for physicians and professional advertising, depends on your registration at what kind of approval you have in the registration for advertising. Also, you will need to renew the registration every 5 years. This is besides all the warehouse quality obligations that you will need to keep if you have an operational warehouse. Next slide, please. Well, that's all the presentation. If you have any other questions, we will be glad to help, or also you can contact us. Thank you very much.
Thank you so much, Gloria. And thank you to Ambassador von Heinitz, to Minister Troy, and to all our fantastic expert speakers. So much great information, really valuable practical insights. So thank you so much. And we'll be sure to share all the slides with you all. And if we didn't get to your question, we'll also be sharing the contact information of our speakers after this. So at this time, I just want to turn it over to Blaine Doyle, the president of the Irish Mexican Chamber, to close out. Thank you.
Thank you so much, Sarah. I think that's been some amazing presentations here. Thank you to all our panelists. Just quickly want to mention some things about the IMC, about Mexico, and about the MedTech industry. I think that the panelists here and the expertise that we've got is testament to the amazing network that we've built here with the Irish Mexican Chamber. Mexico is a population of 130 million people. So I think it's an amazing beachhead market for a MedTech company from Ireland with maybe some export experience in other parts of the world to begin building an amazing foundation to export, not just into to Latin America, but possibly into the US, given the manufacturing capabilities here. And really the pandemic has really changed Mexico. And I think that's one of the most important things, and I think it was mentioned a couple of times, is the fact that really there's a perception of change among healthcare consumers here, and the importance of healthcare has definitely moved up the totem in terms of the needs and wants of Mexicans and of Latin Americans in general. So I think the opportunity within healthcare and within MedTech is really, really expanding here. And this is a market that's definitely open for business and is really, I suppose, a launch pad into the rest of Latin America. Just on behalf of the Irish Mexican Chamber, I want to thank Minister Troy, Ambassador von Heinitz, and the embassy team, Sarah Hill, and the team at Enterprise Ireland for such a good job. Our legal expert, of course, Santi Stephen, who fought traffic to make this webinar. Thank you, Jorge, for joining us. Our MedTech experts, Malu from Udela, and also Gloria from RAFCO Consulting. And also, last but not least, Cecilia V, who is our operations director and has done an amazing job of putting together this webinar. So thanks to everyone involved. Also, thank you for joining this webinar. We're here to advise you, support you, and help basically make you be the most successful company possible here in the Mexican market. And please feel free to contact us over the next coming days, and we can connect you to Jorge, Malu, and to Gloria, respectively, and basically begin making those connections and your first steps into the Mexican market. So thanks to everyone, and please feel free to reach out.